And there's a number of factors at play. Some of the most common ones that I hear about are, there is just systematic bias, right? So there is bias in the medical system that we are becoming more and more aware of that sometimes works against people accessing proper diagnosis and treatment. And that is true not just in bleeding disorders, right? That can be true across other types of illnesses and that patients may face. There is also a difficulty recognizing and defining excessive bleeding. And I think one of the challenges with that is that men and women don't necessarily bleed the same way, right? So physicians who have been within the bleeding disorders community treating men who bleed have a certain expectation of what that's going to look like, and it may not look the same for women. And then also, it can be difficult to measure, right? When we're having a bleeding episode, it's not like we're actually, the bleeding isn't coming out of our body into a container that we can collect and measure how much it is, right? And so it can be difficult to really quantify what that looks like. Again, similar to what we've said, it doesn't always look like the textbook, especially for women. It doesn't look like what the doctors have studied in school. And then the last point, sometimes we have a great deal of difficulty being referred to the right type of hematologist. And what do I mean by that? Well, what I mean by that is that in hematology, there are really, in its broadest sense, sort of two classifications, right? There is benign hematology, which is non-cancerous types of blood disorders. And then there is what really the vast majority of hematologists practice, which is more treatment of disorders like leukemia, like blood cancers, right? And so if we get referred to a hematologist, maybe because of our doctor or because of our insurance that isn't familiar with bleeding disorders, they may be less likely to get us an accurate diagnosis.